Good morning and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg and I'm a research study coordinator with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy all the way from Paris, France. Once again, Dr. Murphy, how are you?
I'm great.
Our viewers will know Dr. Murphy as the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions each week on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions as well as addressing the latest COVID headlines through today, June 1st. We invite you to submit your questions below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. I'm going to start out with some updated COVID statistics for the United States. As we previously reported, average and case numbers are no longer being reported. So as of mid-May, there were an average of 10,305 cases per day. New statistics that we do have relate to new hospitalizations per day, which has decreased to 1,179. And average COVID deaths per day have also decreased to 111. We're sitting tight at new booster proportion of 17%. Any reactions to those numbers, Dr. Murphy?
Well, as before, they continue to slide downward. We're definitely going to the low part of the endemic now, and that's all good news. And we'll see how low it goes, and if it stays there, most likely it's going to stay. It's going to be. We'll see where the bottom is actually, but there are small clusters that are occurring, and so you have to always watch out for clusters. Just last week, Connecticut state legislatures dealt with a string of COVID cases leading to mask mandates of elected officials and staff and members of the public on the congressional floor and the galleries. So, we're going to see this periodically in different places around the country. So, it's not gone, but it's definitely at a low level. So remember, around 100 cases, 100 deaths per day is what we see with flu. It's not evenly spread. Flu is not evenly spread around the year. It's mostly just 6 months of the year in the late fall, winter, and early spring. And then, but COVID seems to occur at any particular time.
Right, so it's important to stay vigilant. We of course know that the COVID is not gone. So we're going to start this week with a viewer submitted question. Thank you as always for submitting your questions. Their question is the second COVID bivalent booster only approved for those over 65 and immunocompromised people? And secondarily, is there a bucket of people that you would recommend not waiting until the fall, to get that first bivalent booster that came out in September of 2022?
Well, there's been a lot of data. Some came out actually this week already about the effectiveness of the new bivalent vaccine, new being as of September 1st, 2022. And it's much more effective than the original vaccines because the virus has changed so much. And the new vaccine, the bivalent vaccine, is geared towards all the Omicron variants, which are the ones that are circulating right now. And that the efficacy, staying out of the hospital and not dying, improved over unvaccinated people who've only had the original vaccine by somewhere between 40 and 52%, depending on the different groups there. But I mean, a significant improvement in the response. So what's going to happen if you have not had the new bivalent vaccine and you are at any kind of risk? So, I mean, you're up in age, you have hypertension or diabetes, or any one of the CDC has a big list on their website of what immunocompromised conditions would make you eligible. You should get it now. We're having a cluster in Connecticut, I mean, it's a little bit crazy. So if you've already had that booster, I would wait until this fall because that vaccine is likely going to be modified again. And there's a question whether they're even going to include the original part of the vaccine from the old virus, the original virus, and maybe just go with the Omicron variants. So all that's kind of up in the air right now. But if you've had that first bivalent booster, wait till the fall because it's probably going to be a new and even better vaccine.
Right. That's very important to keep in mind, especially as you mentioned, flu season coming up as well. It's always great to stay vigilant and up to date on those vaccinations. So we're going to move on to some headlines. We've been talking a lot about long COVID the past few weeks, and there was some research that came out this week as to why COVID-19 could be more life-threatening for some people rather than others. Could you tell us a little bit about that study?
Yeah, there's a big study that was published in Nature, which is a highly reputable scientific journal. 24,000 people were studied, and they identified 49 DNA sequences that are associated with becoming critically ill from COVID. So this is just the beginning. Now they have to go through all the caveats, like what other factors did those 24,000 people have? What is the thing that actually makes a person get really sick and die from this disease? So this is just a great start. We knew genetics was part of it from the beginning, but now they've identified these 49 sequences that are associated. So we have to figure out exactly which ones are the key ones.
Absolutely.
Step forward.
Mm-hmm. And another topic relating to long COVID, the Physical Medical Academy issued new guidance on long COVID neurological symptoms in terms of their surveillance. Could you give us an update on what the guidance is?
Yeah, this academy has basically reiterated what we've been talking about all along. But what they're trying to do is to help clinicians and patients figure out if what's happening to them is due to prior COVID. All right. And so they're trying to red flag certain conditions, and those include sudden or progressive weakness or sensory changes, unexplained upper motor neuron signs in the setting of weakness, arm weakness, whatever, upper chest, bowel or bladder incontinence or retention, transient loss of consciousness or syncope or blackouts, acute neuropsychiatric symptoms or psychosis, positional headache. That's if you move your head in one direction or another or backwards, you get a headache associated with local signs, and cranial nerve abnormalities on physical exams. So this a doctor would be able to pick up. So we knew all these things. Excuse me. Anything, headache, weakness, any kind of neurologic problems are all kind of fair game in this whole thing.
Absolutely. And of course, more research is known. If we need to know more about long COVID, it's affecting a lot of people. So it's really great that we're getting more research coming out every week. Moving on to some infectious disease related topics, the CDC has recently warned that dengue fever levels are too high in Puerto Rico and other US territories. Can you tell us a little bit about dengue fever and the risk that we're looking at?
Yeah, so dengue is a virus transmitted to humans through infected mosquitoes. And there's 4 distinct serotypes, dengue 1 through 4. And illness occurs in about 25% of those that are infected. So a lot of people get it and don't even know they have it. And it causes a wide array of symptoms. I mean, it can be just mild achiness and fever to full-blown shock, and in some cases, though it's pretty rare, death. If a person does get any symptom at all, about 5% of those symptomatic cases get quite severe and will result in hospitalization and maybe even death. There were 31,000 cases of dengue logged into the CDC and US territories. between 2010 and 2020, and over 96% of them occurred in Puerto Rico, followed by American Samoa, the U.S. Virgin Islands, and Guam, and all these tropical areas. But if you look at it globally, there's really many millions, 57 million cases of dengue were logged in 2019 alone, and 36,000 deaths total in just 1 year. So worldwide, it's a big problem. Here, it's in the tropical areas, and Puerto Rico is number one because Puerto Rico is so big. It's 3.5 million people. Those other, Virgin Islands and Guam, and much smaller. So the big problem is in the United States is Puerto Rico. There have been a few indigenous cases in Florida, Hawaii, and Texas, but really just in the single or low double digits. Approximately half of the cases occur in younger people under the age of 20. And all sorts of things are leading to this kind of resurgence of dengue, including globalization. And as the areas get warmer and the tropics kind of spread north, the dengue is going to go with it. So, there are some reasons for hope. There's just targeted clinical observation and supportive treatment greatly reduces mortality. And vaccines do exist for young people. They appear to be very effective in 19 to 16 years of age in people who've had a previous infection. So we're moving kind of in the right direction, and there's likely to be oral medications at some point too.
Absolutely. And lastly, Maine CDC, the state of Maine, has confirmed a fatal case of a rare Pawasan virus. Can you tell us what that virus is and a little bit about it?
Well, it's a pretty rare tick-borne illness. Lyme disease is a tick-borne disease. I think everyone's familiar with that, but this is much less common. Again, many of those with Pawasan virus are asymptomatic. They have no symptoms at all. However, symptoms can have a later onset, like up to a month after they've been bitten by a tick. And the symptoms are vague and could be maybe misdiagnosed as Lyme disease. So that's why the CDC is mentioning this. And it's a fatal case reported up in Maine. So the symptoms are pretty vague, fever, headache, vomiting, weakness, confusion, seizures, or memory loss. And, it fits in with other kind of diseases like that in the summer. And there can be some serious neurologic problems associated with it. Again, if a person is severely ill, ends up in the hospital, there's a 10% mortality rate. So, it's something that you have to take seriously. So how common is it? It's not that common, as I said. In 2021, CDC recorded 23 cases with 1 fatality and 2 fatalities in 2022. It's, Lyme disease affects 400,000 people each year. So it's a much less, but it's serious if you get it. So it's just one of those things to keep in the back of your mind if you do get sick on a holiday trip, especially if you go out on the East Coast, or Wisconsin and Minnesota also have had outbreaks. So it's kind of pocketed in the upper Midwest and the Northeast coast.
Absolutely. And as you said, it's very important to stay vigilant as we move into these warmer months. Ticks do like it when it's warmer. So if you are going to an area, a wooded area, or spending a lot of time outdoors, make sure that you check yourselves and your pets, family members for ticks. They're not fun. So thank you, Dr. Murphy, so much for answering viewer questions and reacting to these headlines. As always, we very much appreciate your expertise and your time. Thank you.
Great. Thank you, and have a great weekend.
Thank you. Have a great one, everyone. Please remember to submit any questions you have down below. The links to our email, YouTube, and Facebook page are down in the description box below. So feel free to reach out to us and we will answer your questions on the next episode. Thank you.